Good evening, good afternoon, and good morning. This is the 2117th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. SHREYA JETHVA. Let us begin the session with 1 minute silent prayer. As you all know, the International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have the local language session in Malayalam. We are uploading the videos on the very next day itself so that those who miss the session can watch it again. You can subscribe the same without paying any money. You can share it with anyone who loves homeopathy. The purpose of this forum is to take homeopathy to every home around the world, as well as connect between the doctors around the world. And we have so far uploaded more than 3,800 videos at YouTube. And those who want to see the previous one, you just search Ifph Homeopathy at YouTube. And today, let me come to our guest, that is Dr. SHREYA JETHVA, and she is working as she has completed MD and was assistant professor, Department of Surgery, Rajkot Homeopathic Medical College, Pearl University, Gujarat. We are lucky to have such wonderful persons from Rajkot Homeopathic Medical. Lot of doctors from that college has presented different sessions, and all the sessions were exemplary, brilliant ones. And Dr. SHREYA has more than 5 years of clinical experience, as well as more than 4 years of practical experience and teaching experience also. And Doctor will be talking a wonderful subject tonight, and that is beyond the scalpel, as you know. It's something that is happening beyond the scalpel. That is scope of homeopathy in post-operative care, an integrative approach to post-surgical recovery and rehabilitation. This is one of the area where homeopathic doctors can do wonders, and a lot of patients got wonderful results from homeopathy in this way. Without touching the scalpel, we were able to surgery. That's what homeopathic surgery is all about. So we proudly welcome the guest of the day, Dr. SHREYA JETHVA. Welcome.
Thank you, sir. Thank you.
Yes.
Sir, shall I start the session?
Yes, you can start the session. You can share the screen and everything is.
Okay, sir.
It is better to adjust your camera a little more. Yes, now it's.
Sir, is it visible this slide?
Yes, everything fine. You can go ahead. Your co-host also.
Okay, sir. So, as you all know, the today's session is on the beyond the scalpel, the scope of homeopathy in post-operative care and integrative approach to post-surgical recovery and rehabilitation. So, in this session, we talk about why the surgery is needed, on which condition, what are the basic indications for the surgery, then what is the post-operative care, post-operative period, then the scope of homeopathy and this period, also what is the integration and the integrative approach and the recovery and rehabilitation. So we discuss each step one by one. So let's start with the first, why a surgery is needed. So surgery is performed when a medical management alone is insufficient to restore health, function or survival. Even Dr. Honeyman also mentioned in aphorism 186 and 187 that there are some pure surgical diseases in which the cause is the outside mechanical, and in this condition we required some surgical intervention, and after that a vital force can heal with itself. Okay, say for example, if a person have some road traffic accident or have a trauma, now he has a fracture, and in a fracture, the bone is broken on a multiple fragments. So in this condition, a medical treatment alone can't the joint of the some bone. Okay. So in this condition, we required some plating or some other condition or other measurement so that a broken bone can joint with him. So in this condition, the surgery is required. And this is the some major indications for the surgery, like for the diagnostic purpose. As for example, a biopsy of tumor. If we want to know that the patient having the benign tumor or malignant tumor, even which cell in the tumor are proliferate. So that for the diagnostic purpose, we require the scraping of this tumor part, and we went for this laboratory to know that. Another indication is the exploratory procedure. Like in intestinal obstruction, we do a laparoscopy so that we can know that how the complications are occur, which pathology we can see. Then another major indication is the curative treatment, like removal of the appendix in appendicitis, then tumor excision, especially if it is a cancerous tumor, or if it is a benign, but it can compress the nerve or other organ, and that leads to the severe clinical features. Also, another example is the removal of the gallbladder in cases of the gallstone. So this is the two major indication. Another is the life-saving procedures like a trauma surgery, like the patient have the crush injuries or the traction injuries, or he has a multiple broken fractures, etc. So in that cases, we also patient goes for the surgery. Another is the emergency cesarean section for the complicated labor to save the mother and as well as child also. Then the surgery for complicated intestinal obstruction. This is the major indication. Other than this is the restoration of the function like joint replacement, cataract surgery, reconstructive surgery, and we do a surgery for the palliative procedure, especially relief of the pain, bypass procedure or stoma creation, so that millions of surgeries are performed annually worldwide, and there is also advancement in anesthesia, aseptic measure, surgical techniques that can improve a survival rate. However, successful surgery doesn't mean that you remove the organ and patient can cure or restore his health, but it also depends on the effective post-operative recovery and rehabilitation. If you don't see a patient or if you don't do a right measure in after operation, your all the condition getting failed. So post-operative care, it is a very critical phase. And again, I'm saying that this successful surgery depends not only on the operation, but also on our recovery. And these are the common post-operative challenges that as a physician or a surgeon, even a patient can face on a daily basis who undergone surgery, like pain at that area, inflammation at surgical site, or edema, that is a delayed wound healing, anxiety, stress, even a functional limitation. This all aspect can increasing interest in integrative approach to improve a recovery outcome. So why an integration approach is needed? I'm not saying that we replace one system or we replace another system. I'm just saying if integrations are allowed, it means working together. Like suppose we give example of fracture. If the person having a fracture, he undergone a surgery. Now we can give a calcium or any magnesium salt or supplementation to a better healing. Also we do a physiotherapy, because if the person having a 2-3 months of immobilization of that area, so now the joints are not working as it is before. So in this condition, he needs also physiotherapy. Then nutrition support, because we all know that if a person have a nutritional deficiency or he can't getting a good nutrition, then healing can't occur. Then also psychological support, like patient have lot of anxiety, lot of fear, lot of any kind of the depression or anything. So in this condition, we can counsel this patient. And our main weapon, this is the homeopathy, because we can't treat just a particular condition. We treat the person as a whole, and we can provide the psychological support. We can provide a good nutrition by the auxiliary measures. We can give medical treatment, like we have a good medicines. So we need integration. Now we understand that what is the post-surgical recovery period? What happens after the surgery? So there are the 4 phases of the recovery. First phase, the immediate stage that starts just during the surgical procedure, and this lasts up to the 72 hours. It means 3 days. And what happens in this period? There is the pain at the surgical site, there is the inflammation, and we need stabilization of that area for the recovery purpose. Okay. The second phase is the early recovery phase that start at the day 3rd and last up to the 14 days according to the injury or surgery. And in this phase, the wound healing occur. Now, what is the wound healing? So during any surgery, surgeon do incision at that area, and there is the tissue injury occur. So there is the gap in the continuity of the skin, tissue, muscles, or anything. And to pack this gap, we need some elements, some salts that can seal this gap. So after the end, we get the scar. So this phase is called as the wound healing, and there is mainly 3 phases. First is the inflammatory phase that occur in an immediate phase in which vasoconstriction occur because we want to prevent the hemorrhage, and also there is the inflammation occur to prevent the further infection. The second phase is the proliferative phase in which fibroblast and collagen type 3 elements come at that area and trying to seal this gap by haphazardly. And the third phase in this recovery phase is the intermediate phase that lasts up to 2 to 6 weeks in which the tissue are getting remodelized. It means now the fibroblast and collagen type 3 are now sealing the gap in a proper alignment. So after the end, we get a clean, neat scar, which is the painless. There is no itching, no pus, no redness, no any kind of the abnormality. And after this tissue remodeling, the last phase is the rehabilitation phase. It means the functional recovery phase, and that lasts up to the weeks to the months. So in a post-surgical recovery, there are the 4 phases. And so that our therapeutic goal is to be pain reduction in our first phase. There is the control of the inflammation, promotion of the healing, and enhancement of the quality of life of the patient. And what is the potential role of the homeopathy in this case? So in a homeopathy, the post-operative care may be considered as a supportive modality. We have the medicines that can manage the pain issue, reduction of the bruise and edema at the local surgical site. There is a support during the wound healing, anxiety and emotional distress, recovery from anesthesia-related discomfort, and individualized rehabilitation support. And as this is the therapeutic principles like individualization, support, symptom similarity, and holistic patient assessment can enhance the quality of the life of the patient. So now we move towards our main session, that the post-operative problems and how as we homeopath can help in it. So this is the most common complications like pain, bruising, swelling, surgical trauma, delayed healing, fear, anxiety, fatigue, etc. And we learn each complication one by one. First, we see post-operative pain. So why the patient have pain after surgery? So the surgical incision at that area causes the tissue injury, and this tissue injury releases the inflammatory mediators, especially the prostaglandin and cytokines. These both mediators create the pain sensation in patient. There is also irritation of the nerve, muscle spasm, and edema around the surgical site. So this whole the effect can cause the pain in patient. And patient have a complaint of the tenderness, soreness, throbbing pain, or the pain on the movement. And we have such a wonderful medicine that can help in this condition, starting from arnica. I can say the arnica is a mother of all the injury medicines, especially a mechanical injury, and there is so much pain, there is a sore, lame, feeling, and patient feels that the part or arm is as if beaten. The second one is a hypericum, if there is a nerve injury at that area, and there is a shooting type of pain. Third one is a belly spur, in which if there is a deep tissue trauma occurred. Then Stephysagria. Stephysagria is mainly useful if there is a clean surgical incision or post-operative pain after the cuts. And Ruta, if the tissue injury has occurred at the tendon, ligament, or periosteum. The second post-operative complication is the post-operative edema, means swelling. So why it occurs? Again, the surgical incision causes the tissue injury, and tissue injury create the inflammation. And this, due to this inflammation, there is the increase the capillary permeability at that area. And this increase the capillary permeability leads to the leakage of fluid in tissue. And also due to accumulation of the fluid, the lymphatic drainage are impaired. And we can find in a patient in form of puffiness, tightness, and swelling around the wound. So now what we can do? We have the arnica if there is a mechanical injury and if there is the swelling around that area. Epismel, in which there is a puffiness, shiny area, there is a severe stinging type of the pain, patient is hot and the part is also hot. Then belly spur if there is a deep tissue trauma. Lidumpal is specially used if the surgery of the eye and the puncture wound edema. Then hemamelis if there is a venous congestion with edema. The third one is the bruising and hematoma. The bruise and hematoma are somewhat similar terms in which no skin is the vulnerable or no skin is torn. The complete skin is the intact. But in bruise, there is just a discoloration of the area due to rupture of the capillaries. And in a hematoma, there is a large quantity of the blood are collected and you find like a tumor. So why it occurs? Because damage to blood vessels during surgery and the blood are collected beneath the tissue and also after the local inflammation. And patient have the bluish, blackish, purplish discoloration, the tender swelling and the local soreness. And again, we can prescribe arnica, hemamelis if there is the venous congestion, belly spur again if there is a deep tissue trauma, Lidumpal, especially bluish ecchymosis around the eye or after eye surgery and in a puncture wound, and phosphorus who have the hemorrhagic diathesis. Another post-operative complication is the delayed wound healing. Okay. In a previous slide, I just explained that there are the mainly phases of the healing. There are the three: inflammatory, proliferative, or the remodeling phase. Okay, and the phases of recovery are mainly four. Okay, so if any this phase, there is the complications like if there is the local site infection or the person having the diabetes or have a nutritional deficiency, if there is the excessive tissue trauma or the poor circulation, this all factor leads to the delayed wound healing. It means there is the slow granulation. The fibroblast and the collagens are not packing the seal perfectly. And the wound are also persistently discharged of the pus or any other necrotizing material. And there is the delayed closure. So in this condition, we can prescribe the calendula as also in a dressing or in an oral form to promote the healthy granulation and prevent the disfiguring scar. The Stephysagria, especially after the clean cut injury and there is a lot of pain and delayed wound healing. The Cilicia, if there is so much suppuration, pus are discharging and scar are the disfiguring. Graphitis, if there is the scar formation, but it is too much thick. And belly spur, if there is a deep tissue trauma injury. Another post-operative complication is the surgical site infection. If we do not proper observation of the wound and do not do a right measurement, then surgical site infection occur so much commonly. Why it occurs? Either due to bacterial contamination or poor aseptic technique during surgery and even after dressing. There is a reduced immunity in a patient, like the patient having the tuberculosis, HIV, leprosy, typhoid, etc. or patient having the diabetes. And the clinical features are the redness at that area, the part is hot to touch, there is a lot of pain at the surgical incision, the pus formation are occur, and person having the low to high grade fever. And we can prescribe the hepasulf calcareum if there is so much suppurative pain and the hypersensitivity of that area. Calendula officinalis if we want to promote the healthy granulation and prevent the disfiguring scar and prevent the infection. Silicea again if there is so much suppuration. Pyrogen if there is a high grade fever, septic condition, and with the wound healing delayed. And the gunpowder, which is the traditionally used medicine as a aseptic protocol. Another, the post-operative complication is the scar formation, that is the abnormal scar, especially the keloids. Okay. So why it occurs? Because the excessive collagen deposition in a proliferative phase. And also there is the genetic predisposition and the prolonged inflammation. And at the end, the patient getting the raised scar, which is so much itchy, painful, and there is the redness at that area. And there is no limitations of the growth. The scar are growing and growing. There is also itching, and this is the cosmetically concerned condition. And we can prescribe the graphitis if there is so much thick scar which is itchy, redness. Thiocin is also good medicine for the keloids. Silicea if there is a thick scar with the suppurative condition. Calcarea floor if the scar is too much hard and indurated, and calendula for promotion of the healthy granulation. Up to this, the post-operative complications are the local one at the surgical site. Now we move towards the general complications of the surgery, like due to anesthesia or some medications or GI disturbances, etc. The first one is the post-operative nausea and vomiting. So why it occurs? Generally it occurs after the general anesthesia or some analgesic, otherwise the vestibular stimulation or GI irritation. And patient may feel nausea, vomiting, dizziness, and poor oral intake. So we can prescribe the Nux vomica if the nausea and vomiting induced after the anesthesia or some analgesic medicines. Ipecac if there is a persistent nausea and patient wants to vomit and after vomiting the nausea can't relieve. Coculus if there is a nausea, vomiting with dizziness. Tabacum also we can prescribe if there is a nausea, vomiting, dizziness. There is also cold sweat and it occurs after some motion sickness or due to the anesthetic effects. Petroleum we can also prescribe if there is a nausea, vomiting that are the persistent. Another, the most common complication is the post-operative constipation. It is the common in after surgery due to mainly the anesthetic effects. It also occurs due to the some medication, either reduced mobility of the intestine or due to dehydration. And the person having the hard stool, he requires the great straining to pass stool, and there is the abdominal discomfort. And we can prescribe Nux vomica if the constipations occur due to some medications and person feel that my bowel is not empty, I have to go repeatedly for the stool, and this is the ineffectual urging. Opium if the constipation occur after anesthesia and there is a hard ball like stool and there is the obstinate constipation. Bryonia alba, if there is a hard, dry, knotty stool, and especially there is the dryness of the mucous membrane. Alumina, in which due to the sluggish intestine or the sluggish peristaltic movement, and patient does not want to go stool for many days to many weeks, and he requires a great straining to pass through. And the lycopodium, if there is the constipation with the so much great flatulence and weak digestion. After the constipation and nausea vomiting, the neglected part is the psychological complication, mainly anxiety, sleep disturbances. So why it occurs? Generally due to the fear of outcome, especially if the person having cancerous condition and he went for the surgery. So he thinks that, am I curable? Am I recover? Am I live or not live? What the surgeons are saying in follow-ups, etc. The fear of the outcome. What happens after surgery? There is a lot of pain during the surgical procedure after surgery. So patient have an intolerance for the pain and or loss of sensitivity of the pain. Another is the hospital environment. We all know that during the COVID situation, in all the hospitals, the patients are dying one after another. So patient have also fear and anxiety of his also health, his recovery, his life, etc. The hospital environment is also matters. And the stress response of the patient in this condition. And the patient may have the restlessness, either physical or mental restlessness, insomnia, anxiety, and fear. And in this condition, we can prescribe aconite if there is a lot of fear, any kind of the fear, especially the fear of the death. And the patient says that now I am dying on this time. There is also agonizing in the pain. Then gelsemium for the anticipatory anxiety. What happens next? What happened next? So gelsemium. Then arsenic alb. She has also the fear, anxiety, even the hopelessness regarding the recovery. And he thinks that this is the useless thing. I am dying surely. Then coffea cruda, if the person are frustrated due to the pain and sleeplessness. And ignatia amara, if the patient are repeatedly recalling the things that surgery is occurred before the 1 month, but still he thinks that the surgery is occurred today or yesterday. The patient can't forget the event. So in cases, we can prescribe the ignatia. Another complication is the post-operative neuralgia. There is the nerve pain. So why it occurs? The nerve injury during the surgery or the scar entrapment or inflammation around the nerves. And person having the burning pain, tingling sensation or electric like shock pain. And in these cases, we prescribe the hypericum if there is the nerve injury, especially the sentient nerves. And there is a shooting type electric pain. Magnesium force is also good medicine for the spasmodic pain and the nerve injury. Posticum, Calmia, these both medicines are also useful for nerve injury. And Spigelia, if there is a radiating type of the pain. Then the hoarseness of the voice after intubation or tracheostomy. So why it occurs? So during the intubation, there is the mechanical trauma to the vocal cord. Also, there is sometimes the laryngeal edema, the mucosal irritation, and sometimes it occurs due to the recurrent laryngeal nerve irritation. This all leads to the hoarseness of the voice. Just after surgery, it can last for the months or weeks. Also, there is a weak voice fatigue, there is throat soreness, and difficulty in speaking. So in these cases, we prescribe the Arnica montana if there is a mechanical injury. Causticum, if also we can prescribe also if the voice are so much weak and patient's muscles are fatigued. Then phosphorus, if the hoarseness or weakness of the voice that is aggravated by speaking, laughing, etc. Argentum metallicum, if there is a hoarseness of the voice by the louding of voice. and belladonna if there is an acute inflamed area around the larynx. Another complication is the urinary retention after surgery. Generally, it occurs due to the spinal anesthesia or general anesthesia or opioid analgesic. Sometimes it also occurs due to the reflex inhibition of the bladder contraction or pelvic surgery, especially in a female during labor. And patient is unable to void, there is the bladder distension or lower abdominal discomfort. So we prescribe the causticum if there is the retention of the urine after the surgery or after catheterization. Then opium if the retention of urine, especially after anesthesia. Aconite if the retention of urine because of the anxiety or fear. Nux vomica if retention of urine due to some drug effects. And lycopodia if there is a feeling that my bladder is not empty completely and he requires a great straining to void. Another post-operative complication is the post-operative cough after intubation. So generally it occurs after intubation or tracheostomy or sometimes the airway inflammation or dry mucosa. And person having the dry cough, throat irritation and pain while coughing. So we prescribe the phosphorus if there is a dry irritating cough. The cough is aggravated by the laughing, speaking, etc. The Drosera, it also prescribed if there is a dry cough, spasmodic cough. He requires, also having the chest pain. Rumex we prescribe if there is a tickling type of the cough. Bryonia if there is a dry cough and this cough is aggravated by any movement. And belladonna if the cough occurred due to the acute inflammation of the airway. And next complication is the phantom limb pain. Means the pain occur at the amputation site. Undergone the amputation, especially in a person of the gangrene. Why it occurs? Due to the peripheral nerve injury or the central nervous system reorganization. That he can't have this limb now. Then neuroma formation at that area and person feeling the pain in the absent limb. There is the burning sensation at that area and electric shock like pain at that area. And we prescribe again hypericum if there is a neuroma formation. Allium cepa is also good medicine for the pain, burning, irritation at the amputation site. Causticum we can also prescribe due to the pain, irritation at amputation site. Also Staph aureus for surgical incision and the pain at amputated site and Megphos. So up to this, we discussed the local inflammation and post-operative complications and also the general complications. And post-operative recovery extends beyond the wound closure. It means it doesn't mean that if you do a surgery, now patient is completely cured. Person may feel physical, functional, psychological complications after surgery. And homeopathy offer an individualized patient-centered approach that may support recovery, selected post-operative condition, such as the pain, bruising, delayed wound healing, neuralgia, hoarseness, or anxiety and sleep disturbances. So, multidisciplinary collaboration among the surgeon, physician, physiotherapist, psychologist, and homeopath can promote the holistic rehabilitation. And I just conclude this slide by just one quote that successful surgery is not merely the absence of disease, but the restoration of the function, comfort, confidence, and the quality of life. This is the references that I took. Okay, so audience, I just want to ask one question that if the person have undergone intestinal obstruction surgery, just before 10 days. The patient age is 57 years. He is a male. He goes undergone the intestinal obstruction surgery. But now the patient have a feeling that there is the hoarseness of the voice. The voice is so much weak, especially if he speak a lot. Now you tell me that how we can help with the modern medicine in this case. We just discussed this slide, the topic, the hoarseness of voice. Okay, I just conclude the session from the my side. Thank you, audience.
SHREYA JETHVA, it's really a very good session, and how important homeopathic medicines in post-operative conditions. You arrange a beautiful session for us, and almost all medicines came across with the post-surgical condition. I still remember a case of absolute constipation. Once some uh, 35 years back when I was just a practitioner in the beginning, and one day some people came to my clinic and asked me to take a visit to their home because the patient is bedridden and is not able to speak. And when I reached there, there was hundreds, nearly 100 persons were waiting for there. What I saw was the patient was really lying like a dead log. And I thought that it may be they want me to confirm whether the patient is about to die or die. When after reaching there, I found that only very slight respiratory movement and cardiac movement. So I confirmed that I just asked them to wait for some 48 hours so that we can give some medicines also. If the patient is unable to take medicine, and when I inquired about the case, they were told that the doctor, she had a surgery some 3 weeks back, and after that she was discharged with this absolute constipation, and there was a constipation at the end also. Actually, when I inquired about these things, I found that the poor patient was taking medicine for asthma for a long time. And in those days, even medicine can buy from anywhere. So there was a cock who was just giving these asthma medicine and steroids, and that's the reason why she got this constipation. And after surgery, they found that they told them that we have done our best, but it is for you to take care of this thing. What happened was that even after giving some medicine by these people, she was unable to pass this too. And on the second day, when I visited there, I found that there is a slight relief. In the first part, I just blindly gave an Axomica, but after reaching there, I found that the patient was whispering like this, "Oh my God, oh my God," like that. So I thought that it is she is praying for death or praying for recovery. So because of that, I prescribed stramonium, vanam.
Yes.
Do you know what happened? It was really a miracle. Thereafter, within 24 hours, when I visited on the third time, what I found that there was only 3 to 5% around her, and she passed the stool and everything, and she is quite okay. And then she lived up to some 15 years more, and that was really a remarkable recovery. People thereafter, a lot of people from that area came to for consultation in my clinic for homeopathy. So this is how homeopathic medicine works for these post-operative conditions. Anyway, it's the time for discussion. Those who want to talk, you can raise your hand so that we will allow you to unmute yourself and you can speak. I'm inviting our Professor Vibhu Prasad Pandey sir to begin with.
Thank you, sir. I am audible.
Yes, sir.
Actually, I am very much impressed in the presentation of Dr. Shreya. As we have having time, so we are discussing. So, in our homeopathic Metromedica, Staphyagria is also a very good medicine. which is very useful in post-surgery. That's why SHREYA is also called as a homeopathic surgeon. Second thing, amyl nitrosome, that is a very good medicine which we can use to antidote the anesthesia. If the anesthesia or the patient becomes senseless for longer time, then amyl nitrosome can be used. Another thing, in post-surgical cases, so we can take the help of external application also, along with the internal medicines. So nowadays the government Ayush system as well as our NCH is prioritized in integrated approach. So we have to take the help of other system of medicines which are very useful for this purpose, as Dr. Shreya was telling about physiotherapy. So physiotherapy, warm applications, and we know our medicine Arnica montane is also a very good medicine for after pain. That means after delivery, to reduce the pain, Arnica montane can be used. Second thing, one thing need to be added, that is about the potency selection. Dr. Dhanesh, I would like to ask you about the potency in your case where you have given stramonium, and what is the reason of that potency?
Frankly speaking, we should have given low potency, but in those days, I was not because I prescribed the same on the mental plane, and she after recovery, when I asked her about the symptoms, I found that she was too religious. These are all the things I because I had a personal talk with her only after recovery, because otherwise she was not able to take. She just when I was sitting in very near her, I heard simply like this. She used to say something, but I couldn't hear, or nobody could hear. But I was just sitting closer to her and listen what she was saying. Then only I said, "Oh my God!" In our local language, "Enda Deivame." This is what in English which is my oh my God, oh my God, oh my God, like that. That means either she may be praying, but after that, after the recovery, I found that she was exactly a religious person, too much belief in these religious matters, and so that is the reason why. So what I want to point out here is that a homeopathic medicine can be chosen according to the mental symptoms, whether and if it is the constitutional one, it doesn't matter what kind of disease it is or what is the disease condition. It doesn't matter. It works at any time, at all time. That's what I would like to add, sir.
Sir, actually, in homeopathy, we are considering the susceptibility whenever we are selecting the potency. But when we are prescribing on the basis of the affected organ or therapeutic medicines, so which is not covering the dynamic part, we need to give low potency as you have stated. So what I am suggesting, so when we are prescribing medicine on the basis of affected organ, or what I am telling, to reduce the pain or to give relief to the pain, so we need to give low potency. And when the case is covering as a whole, that means on the basis of dynamic symptom, whenever we are prescribing, we may prescribe medium potency or a higher potency. Actually, the three conditions must be fulfilled. Only similimum cannot cure. So along with the similimum, dose and potency and repetition is also required. So as per the intensity of the disease, nature of the patient, so if you will not repeat the medicine proper time with proper dose, then radical cure may not be established. So in case of post-operative treatment, when we are taking the homeopathic side, then we must consider, apart from the selection of medicine, the dose and potency and repetition. If the pain is intense in more intensity, then we can repeat frequently, and if the pain is tolerable, infrequent repetition may be required. Another thing is, she had stated so many medicines which justifiable examples and with good presentation. So, for example, she has mentioned about keloid, where fibrosis has been already formed out. So, for when fibrosis has formed out, so what is the scope of homeopathy? Though it is pseudo-surgical diseases, Hahnemann has divided diseases into true surgical as well as pseudo-surgical. So true surgical diseases are those where we have to take mechanical aid, because suppose there is a fracture, so we have to take the help of mechanical aid. We have to unite the fracture, then we have to give the medicine symptom calculator like this. Then for quick healing. But the in case of all surgical diseases, for example fistula, piles, where the cause is internal, so we are having good medicines to for the recovery. So the physician must discriminate about the true surgical diseases and false surgical diseases. If the diseases are false surgical diseases, that can be cured by proper homeopathic medicine also. So our aim and objective, if there is urgency where we need to take the mechanical aid, we have to take the help of surgery or surgeon. And where the diseases are not true surgical diseases, if they are false surgical disease means pseudo surgical diseases, in those cases we have to treat only by internal medicine. And if the injury is not dangerous, then you can take the help of only internal medicine to treat piles, fistula. Yes, we are having good medicine for lacrimal fistula, silicea. So then keloid, we have also medicine like silicea and other medicine, calculator to treat the keloid. So where the diseases are purely surgical, then in those cases we have to take the help of surgery. And keloids, as she told, that it is formed after surgery, so that is post surgical complications. In those cases we can treat the disease by internal medicine, as well as we can apply some external application for soothing purpose also, what I am suggesting. Is it right, sir?
Yes, sir. Yes, sir. What your suggestions are absolutely right. Dr. Shreya, what's your opinion on that also? I mean,
Sir, as sir told that this is the right. We have the scope in a post-surgical period and also to prevent the pseudo-surgical cases also. And if the keloid are already occurred, okay, so we have a good medicine thiosin. Nowadays, surgeons are also using in an injectile form to remove or shrunken that keloid. And the surgery after the keloid, that is not required in this condition. So we have also scope in this condition.
yes, as sir rightly pointed out, the potency shall be in proportion to the susceptibility of the patient. That's that's a very important point to be noted. And that's how, when you can apply medicine, you will get the result in the shortest possible time. Of course, even a low potency or a high potency or a medium potency, you may get the result, but it may take the time. But if the susceptibility is directly proportional, the potency is directly proportional to the susceptibility of the patient, the result will be fantastic and very good. And your principal, sir, Dr. Hirdar Mehta sir is here. Sir wanted to speak to you. Yes, sir. Welcome, sir.
Good evening, sir. Good evening.
Good
Sir,
evening.
you have nicely explained your case. That is absolute constipation that has been treated with the stramonium. And Panda sir has nicely described the miasmatic evaluation in terms of the pseudo-surgical and surgical cases for the post-operative care. And I am very much impressed with the presentation of the Dr. Shreya. And Dhanesh sir, she has won the best thesis dissertation award in Faculty of Homeopathy before 3 years. When she has joined the institution, she has won the best thesis award from the Parul University. So nicely correlate the all the medicine with the causa externa, causa interna, Where cause is external, we have to look for the medication. Internal cause can be corrected with the potentized medicine only. And when the cause is external, there is need of the pure surgical intervention. So nicely explained by Dr. Shreya. And in terms of the miasmatic evaluation as well as the certain remedy, Echinacea calendula, which is very much useful for the dressing perspective, as well as we can use along with the Arnica montana and Hypericum she has already described. And one more medicine, Bellis perennis and Ruta, she has explained in terms of the injury, railway spine, and neurological effect to the smaller joint injury. But in terms of the Ruta, any kind of the smaller joint injury, we can think of Ruta in clinical practice. And Echinacea is a very useful remedy to avoid the septic condition, along with the Crotellus horridus. Crotellus and anthracinum is a wonderful remedy for the atrocious burning pain, where we can use in terms of the carbuncle as well as the to avoid the second infection in a given case. Thank you very much, Freya, for your wonderful presentation. Thank you, Danesh sir, for giving wonderful opportunity to the faculty of Rajkot Homeopathic Medical College.
Yes, sir. We are lucky to have such a wonderful person like you, sir, in giving all the members of the faculty to be here and make their presentation. Once again, we are thankful and to you, sir.
Thank you, sir. Thank you, Panda.
Now I am inviting Dr. Boblin from Malaysia. Yes.
Thank you, Dr. Danesh. I'd like to say also a big thank you and our deep appreciation to Dr. SHREYA JETHVA MD, the Assistant Professor from the Rajkot Homeopathic Medical College in Gujarat. And she has presented a very, very detailed, sharp and precise presentation and very fast. We make it within half an hour and we have even time for discussion, and that is very good. And also the sharing by Dr. Danesh through his experience with using stramonium, and Dr. Hirat. And I agree with what Dr. Hirat says just now. She was mentioning about Echinacea, Anika, and so forth for the post-operative. I think, as for me, I think for the post-operative care and management by homeopathy, the first thing we have to consider is because of the various drugs that they have put into the body, especially when they're using anesthesia, either LA or GA. So we have to remove the drugs from the body. So I will recommend that we use
Yes, sir.
then follow up by whatever physical symptoms they have that you should observe. And one thing is, I remember once I used ATTEES because there is a sign of edema and some post-operative cyst left there. So I think it helps a lot in this case. So thank you again, once again, Dr. Shreya.
Thank you, sir.
Thank you, Dr. Boblin. And now it's up to Dr. Rambaresh sir to say what are thanks to this session. Please unmute, sir. Please unmute.
Thank you, Dr. Dhanesh ji, and Namaskar, Dr. Vibhu Panda sir, Boblin sir, everyone, Namaskar, congratulations, Dr. Shreya. Wonderful presentation, post-operative care. The surgeon removes the pathology. Rehabilitation restores the patient. Integrative care aims to the support both the healing and recovery. Homeopathic, lot of medicine. After surgery, SHREYA is a very good remedy. And Hypericum, Arnica, Trauma, and Ruta, and its pyrogenum. Pyrogenum is the septic condition, है ना, calendula, echinacea, तो lot of medicine after post surgery. So very thanks Dr. Shreya, behalf of IFPH whole team. Very thanks again presentation and thank you. इसी तरह से घर घर होम्योपैथिक, हर घर होम्योपैथिक. Thank you.
Namaskar. Atalaga.
Thank you, Dr. Ramparesa sir, and thank you, Dr. Shreya, Dr. Hridayat Mehta sir, Dr. Bipul Kumar Panda sir, Dr. Ramparesa sir, and those who attend in this English session tonight. And tomorrow we will have a session from Dr. Kudanta Rabani from Rajkot Homeopathic Medical College, and she will be talking about understanding the characteristic nature and processes before intervention, neoplasia recorded. So hope all of you will join the session tomorrow at the same time. Thank you all. Good night. Dr. Shreya, you want to say anything?